How does end of life deal with that? We think what?
DNR.
DNRs. Sometimes we think what? They either need to what? Turn it off? Or they're turning it off too soon, right? We're not judge and jury, but that's a big pill to swallow sometimes. And our emotions do get in it, and our personal experiences. Our job is to take care of the patient the best we can. What else? Ethical problems. We've already talked about abuse. It's real hard not to jump on the parents when they come in there, if it's been proven. Or if it hasn't been proven yet and you have to transport both. And I had to drag my partner out of the room and put him on the back of the plane, and I told him, I said, if you don't stop, they haven't proven it yet, she can refuse this child to be transported. At this point, I said, we've got to do what we need to do to get this child to Vanderbilt. Police were waiting on her there, but before we loaded the child, she could have said, I don't want her transported. And we would have lost her. And he sat back there and sulked the whole time. What else? Yeah.
I was just gonna say my sister was supposed to do like a rape kit on an infant, and she said that she couldn't do it, so they had someone else do it. She said she couldn't emotionally handle that, so they just switched it out.
So, what's the problem? And guys, we're having discussions. I don't put my views on you. You don't put your views on me. I'm not trying to force anything. This is just things that are going to come up. You need to be ready for this. What would be the problem with forcing her to go in there? She's not going to be able, huh? No, she's not going to be able to function. I'm not going to force you to do something. You're not going to be able to be a nurse. And then all the evidence is going to go out the door. What about religious beliefs? Which one am I thinking about specifically, maybe? Jehovah's Witness. What if their child is injured and bleeding to death? Huh? That you can't give them blood products. You're going to damn them to hell? It's theirs. It's our job to explain the risks, to educate them. That's all you can do. It's not your right to push your religious beliefs on someone else. I wanted to jump on this guy. We were in Memphis. Very senior nurse. She said, hey, can you bring me a Foley kit? Brought her a Foley kit. A few minutes later, hey, can you bring me another one? I'm like, okay. After the fourth one, I was like, so I walk in. I don't know what culture, ethnicity, real pretty lady, guy sitting in the back, glaring at me, and I was like, I looked at her and she shook her head like telling me to be quiet, and I was like, okay. Whatever culture is the genital mutilation, it's gone. It was everything I could do not to say something. If a male had walked in, what would have happened to her? Their belief, I hope he wouldn't have done it there. If a male walks in that's not related to him, they can stone her to death. I found all this out later.
You say stone?
Yes. I beat her to death.
I think it's Turkey.
A lot of African countries do it.
She was not African American. She was dark skinned. Yes, ma'am.
So, could you intervene at that point if they say were to do that in the hospital just because, like?
Yes, that's patient safety. I mean, you're not going to beat my patient up and stone them to death there. I mean, that is safety. I mean, your religious beliefs go to a certain point. My part was the genital mutilation, but here again,
They can still pee though, right?
yeah,
That's
But it's almost like
fill it
they're-
up and
they're
explode.
feel-good.
we never did get that Foley. They had to put a suprapubic because it was mutilated. Guys, you're gonna run into all kinds of things that you do not agree with. As long as it doesn't impact the safety of your patient, huh? So we did an active shooter drill at Volunteer State with a paramedic program. They had no idea we were gonna do it. We dressed up one of the EMTs as a shooter. My boss was part of the SWAT team, so he brought all his stuff in. This guy played his wells too much. He was blacked out, had on his flak jacket. I mean, to the nines. We did not bring any guns. I'll tell you about that in a minute. I had 5 Bose systems set up. We had called the 911 dispatch, told them what we were doing. This wasn't long after the Las Vegas shootings. I didn't want somebody, it was loud. And I had tape recorded off YouTube every shooting, AR-15, it was loud. We had probably 35 patients, all the EMT students, they had cards. I mean, this was the full Monty. I wanted to see if my paramedic students treated the shooter. He was shot in the elbow. If they didn't treat him, it was gonna be a tension pneumo because it went through and through. My paramedic walked up to him and one of the sheriff's officers like, "Don't treat this piece of shit," whatever. And I saw him look at him and take in a real deep breath and look up at God. And he treated him. That would be real hard because I had several students dead. Be a real hard thing to do, wouldn't it? Because I just want to kick him as I walk by. You can't do it. And so we did have to, just like here, we actually had police officers that were there. We had to bring them over and they kind of supervised. She brought up a good point after it was all over. We need to keep him alive for several reasons, in case there's a bomb, in case there's another shooter, so that we can try to get information from him if we can. I was like, that still don't make me feel no better. Before we started this, my director said, I imagine there's some of the paramedics that have guns on them. I mean, it is what it is. If I had to bet, I don't know. He said, we don't need to do this with all this, and somebody in the classroom is packing heat. I was like, well, how are we gonna get them to take their guns out to the guard? He said, I'm gonna come to the classroom. And he came in, he said, hey, we've had a credible threat, like a call in saying, hey, we're gonna come shoot up the school. He said, so if anybody in here has a gun, I need you to go take it out to the car. And he walked out, y'all. You wanna know who it was? All the females took their purses out. When they came back in there, I said, let me tell y'all something. If there's ever an active shooter in here and y'all don't take that gun out and shoot them, I'm gonna haunt y'all forever. Because I am tired of running and hiding. Damn it, if we going down in a blaze of glory. But there was like 5 students that got up and took their purses out. I felt safe after that. Anyway. But yes, it would be hard to do. With Maslow's hierarchy, physiologic before psychologic. When would the only time psychologic come first? If they're a harm to especially you, but still themselves. If they walk in with a gun like this, that's a definite, it falls under what kind of risk? Safety. Because I ain't worried about A, if they're going to put a hole in themselves with a gun, or you, or they have a knife, or anything like that. Safety trumps all that if you're fixing to get hurt. Talking about safety in the clinical setting, nobody gets between you and the door. Ever. Ever. If you have a even suspected psych patient, do not go in that room, what? Alone. Guys, I know y'all strong. Ladies, I know y'all strong too. Who's the small, and I ain't picking on the smallest lady. Who's the smallest lady in here? Somebody about your size ripped a toilet out of the floor. I can't even wrap my mind. She was schizophrenic and something else. Y'all, I worked in a true mental asylum in Jackson. It's like, these people at Western State and Cumberland Hall are a little bit bothered. If you can pull your own eyes out because they offend you, that Bible verse, you're crazy. Y'all, she ripped, and there were 12 security guards, and she was just throwing them. And so when she got tired and sat down, and she decided she let them, yeah. I'm like, my name's Bennett, and I ain't in it. Life-threatening. What's that old saying? Life over limb. I can live without my arm. I can't live without my life. Airway, breathing, circulation. What's this? Don't remember a damn thing. But sometimes this jumps up here. Why?
It's like an acute
If I can't control if I can't follow commands, and I'm A&O times 1, I can't swallow my spit. Why do we snore? Y'all ever heard old folks say, they have anesthesia, they gonna swallow their tongue? Do you really? Kind of. It goes to the back of your throat. During the seizure, why does that happen? You lose consciousness. If you're A&O times 1, can you control your airway? Cannot follow commands. This is not enough there to control your airway. To control your airway. It's still airway, but it's when disability jumps first. Highest priority is what is going to kill your patient right now. Then what comes next? What's going to kill your patients in the next 5 or 10 minutes, right? Airway, breathing, circulation, disability, all the physiologic. What's way up there? Unless they're trying to kill you. Self-actualization, self-esteem. Guys, I do worry about y'all. I do love y'all a little bit. Self-esteem, psychological safety. You got to be breathing to get to self-actualization. It's not life-threatening, it's health-threatening. You might get yeeted to Jesus, but it's not going to be in the first 5 minutes. If I do absolutely nothing, what's going to happen after 5 minutes? You're going to die. So, it might be a problem that's affecting airway. You have a bad asthma patient that comes in. Their O2 sat's 92. They breathe in real bad, kind of fast, maybe using a little bit of accessory muscles. Is that life-threatening right now? Not yet. That same patient, you walk back in 5 minutes later, has an altered level of consciousness. Hey, they're not wheezing anymore. Is that good? Hell no. They got a silent chest. That is a life-threatening emergency. Everything in their lungs has clamped down so tight. That is life-threatening. You're going to intubate them and try your damnedest to get all that albuterol down in there. This is going to get ugly. It moved from there right down there real quick. And their O2 sat now is 50. Health threatening. What happens if I don't do nothing? This might be 5 minutes. Who said they had bad trauma?
It was our clinical crew.
Yeah. So, how long y'all thought y'all had before something bad happened? Were they bleeding at all?
No, not that we could see.
Were they screaming? It hurt?
The motorcycle guy?
Yeah.
No,
Were they intubated?
he had meds before he came in, and then they gave him ketamine on the radio and all that. He was just, you know. He did make noise, yeah, but I was just like.
It is the lowest priority 99.9% of the time, unless it involves safety. There's something we didn't talk about. Why is this up here? Especially during the summers. What's the worst thing you can hear during the summer? Hold my beer, hey y'all watch this. If you are diving off the house into the swimming pool, please know how far it is, or you're going to land on the concrete. That is not going to turn out well for you. That was my patient at Vandy. Any diving accidents, any trauma accidents, or if you don't know what happened, guys, if it's a medical patient, you're not going to worry about this. Any trauma patients, if you don't know, you've got to control C-spine. What if you don't? And it's like a step-off fracture, and you manipulate that vertebrae. It's going to be a complete transection of the cord. What if it's C3? C3, 4, and 5 keeps you alive. If you completely transect that cord and don't intubate them on the ventilator, they're going to die. C-spine. Breathing. Circulation. Cardiac goes in here. If you ain't got a pump, you ain't circulating nothing, right? Disability. Decreased LOC. Don't remember a damn thing. Exposure. This ain't stripper. This is, you're going to examine the patient. What am I looking for? Huh? First. Before that. I want to look for wounds. Do you always see the wounds when they come in? Yeah.
So exposure is when.
So, do all my brothers and sisters on the ambulance always turn the patient over? No. Your body don't stop here. And when the paramedics said, oh, their pulse, motor, and sensory ×4 are intact, and they had on combat boots up to here that were laced. I pulled him in the other trauma room. I said, you want to tell me how you checked his pulses when his combat boots are still on? I said, go in there and take his boots off. And I said, you better not cut anything. I said, go check his pulses. What did he just do? Falsified documentation. to expose the patient. But what did you just say, Jay? And you gonna, Miss Horton, it's 5,050 degrees outside. Can patients get hypothermic in this? Yes, they can. Especially at Tanoba, they don't keep the trauma rooms warm. Have y'all ever been at Bambi in the trauma rooms? How hot is it? Oh my God, it's like 87 degrees. And it's supposed to be that way. A cold trauma patient will be a dead trauma patient quickly. After you examine them, cover them back up. Is airway and breathing the same thing? No. Airway is in and out. If it can't get in, it can't get down here, right? If it's open, does that mean it's patent? Nope. Just because I'm open your mouth doesn't mean you don't have a big plug of tobacco down in there that you need to get out. Throw the cervical spine in there. Is there a foreign body down in what are foreign bodies? Somebody give me an example besides tobacco. Teeth. Huh? Oh my God, a coin, yes. And a 2-year-old, a quarter is life-threatening. What else? Fishbone, battery in children. Breakfast, lunch, a Huddle House omelet that you have now thrown up. Huh? Hot dogs. My children, y'all, one of the worst events of my life was a 3-year-old that ate a hot dog. They almost died. We couldn't get it out. We had the McGill forceps, and I had a friend of mine with the intubation handle and the light, and oh my God, I cut their, I just stopped cutting their hot dogs up. I mean, that was awful. That child was bad. So. Blood. Can you breathe through blood? No. The goal is a patent airway. If they don't have one, make one. What is your airway broken apart into? Upper and lower. Where's the deciding factor? What's the gateway? Yes, say it louder. Your vocal cords. What's above the vocal cords? What's the flap? Epiglottis. What adventitious breath sounds do you have in the upper airway? There's 2. Strider. We've already said, well, there's 3. We've already said some of y'all's significant other might do this and you want to kill them at night. Snoring. What does that indicate to you? They cannot control their airway. If this ain't nighttime and you ain't asleep, that means they are so unresponsive they can't control their airway because their tongue is falling back and is creating snoring. If they have blood or fluid back there, what is it going to sound like? Gurgling, bubbly. What do you need to do for the bubbly? Suction. What are we going to have to do for the tongue? Get it out of the way. You're probably going to have to intubate them if they're that out. Or figure out why they're that out. If they blood sugar 2, they're going to need some Jesus water. If they don't have an airway, make one. For that child, if she had a quarter and it was like this on x-ray, what if it turned like this? What are you fixing to be doing? You're going to be cutting her neck. So if that's airway, what's breathing? Airway is in and out. What's breathing? It is, are you getting air down there, but it's more the gas exchange, right? This is lower airway. What adventitious breath sounds down here might we hear? Wheezing, what else? Crackles, that's pretty much it. what does wheezing mean to you? Narrowed, and it's kind of got crap in there. Why does it cause that sound? Asthma patients, what's down in there? It's inflammation, so it's narrowed. What else is in there? Secretions and snot. So you got narrowed, and you got all this mucus, and the air is whistling through there. Sorry. What are crackles? If you had listened with our pulmonary edema patient, what would you have heard? Crackle. You could have. That's bad. It's not just, is it there? You got oxygen and CO2. Is it going round and round? Are they able to use it? I got a patent airways going in and out. Okay. And y'all gonna hear me say this so many times. Oxygen don't go where the blood don't flow. If your blood flowing out on the floor, your oxygen going on the floor. And that is the very premises of everything. You're gonna hear me say that in shock. Not just is it there, can they use it? If you ain't got no blood going round and round, you got air going in and out, okay. Do they have a sufficient respiratory rate? If their respiratory rate's 2 because they overdosed on opiates, if they're not breathing adequately, you use your nursing student ventilator, right? A BBM. Breathe for them. Circulation also includes cardiac. Cardiac is perfusion. Is your pump working? Is all your blood on the floor? Is your pump working and your blood's going round and round? How do we see if they've got good perfusion? Cap refill. What else do we look at? Skin color, condition, temperature, blood pressure. Do you have it? If you check all those things and it looks pretty good, then it's probably going round and round. Good pulses. Brisk capillary refill. Is their skin warm? If it's insufficient, what are we going to do? You're going to give them fluid bolus. What kind of IV? 18 at the minimum. What do we really want? 20. Either a 14 or a 16. What if you can't get that? What if you can get a 22? You're going to get what you get and you ain't going to throw a fit. Guys, if you can't get any bigger than that, then you put a 14 gauge in them and we're going to try to give them a fluid bolus and get a bigger one later. If you can get a 16, then you get 2 bilateral 16s. If it is that guy that's a multi-system trauma, if I could get 2 16 gauges, that's what I could get. Because they've got the rapid fluid infusers. If that patient had come in, I don't know what his blood pressure was, and their blood pressure is in the toilet, if you got a septic patient and their blood pressure is in the toilet, I want a big IV. Honestly, I want the doctor to put in what? A central line, because I'm going to give them what? Blood pressors. Is it always A, B, C, D order? We already talked about D, but sometimes C jumps first. Why? Is it a catastrophic bleed? What does that mean? You got the 5 C's. Is there blood on your clothes? Blood on the ceiling? Blood on the concrete? Or blood clear across the room? What kind of bleed is this? An arterial bleed. Have y'all ever seen an arterial bleed? Blood squirts out every time what? Their heart beats. What do they need immediately? Tourniquet. You gotta stop that bleed. Guys, if you don't stop an arterial bleed, you ain't gonna get to A. Concrete, closed. Ceiling, clear across the room. Alright, so when I push play on this, I want y'all to start counting, okay?
We're counting.
Until the person falls over dead. Start counting. There he goes. Hold on. Don't have nobody help him. I don't know what he did.
Okay, count.
I'm trying to be like a one down charity.
How long was it?
Alright, this next one is quick. And I'm gonna have to rewind. Oh, shit, wow. Sorry. Sorry. One, two, three, 4, 5, 6. Alright. You see the gunshot wound? Right there. Alright. I'm gonna rewind it. Because I want you to see he shoots her right. Wait, he shoots her right there. And she don't even know. Look on the ground.
Yeah,
Yeah. Wait, I lost.
Spraying out?
Yeah. And look, that guy came over there and looked at her and then ran off.
is that the same guy that shot her?
No. But yeah, if you look, shot her right there, probably got her, artery. It's all down her and then it's all over, like it's there. That's actually blood and then it's all over there. That is considered a catastrophic bleed. Prioritization using the nursing process. It is always assessment before intervention. You can't intervene without assessing. Hey, did anybody see how long that bungee cord was? I'm gonna jump off this building and nobody looked to see how long that bungee cord was. If y'all can't see it, that bungee cord broke. Hey, go give that blood pressure medication to the patient in room 6. You gonna go give it? You gotta assess the blood pressure medicine first. Guys, do doctors do that? They do. Hey, go give that morphine to the patient in room 4. You walk in there and they're breathing 4 times a minute. You give them the morphine. Oh. What about this? She might need it, but what multiple things are you going to assess? I want to know what. All her vital signs, but what else?
Minor stroke,
Last known well.
her history.
Last known well? Oh, it was 2 days ago I talked to Mom. She getting it? Nope. How old is she? I need to know, I need to go down that checklist. We don't need that damn checklist. You can go in there and give it in. We're getting close to the end of this. This is, we already looked at this. Are they unstable or stable? Guys, a lot of this part is common sense. If they unstable, you're gonna treat them first. Is it a new admission? This should be in your PowerPoint, is it not?
So I can write them down.
Oh.
So I can put it in slides.
Is it a recent surgery that just came back on the floor? Is it a recent surgery that's been up there that just came back on the floor or a new admission? I'm gonna do their assessment first. Because if you up on a med-surg floor, a surgical floor, you would have gotten a report if this is an emergency. If you on a med-surg floor, you shouldn't be getting an emergency. They should be going to the ICU, unless they just didn't call a report. You need to see that patient that just came back from the OR. Unexpected before expected. Came frothy sputum and the client with CHF. Do these people have peripheral edema? Yes. Do we expect that with CHF? No. Acute before chronic. Paradoxical respirations in a client with COPD. What's that mean? Seesaw breathing. Do they normally have that? Do they normally have clubbing in their fingernails? No. Actual before potential. Well, they might get a DVT. Okay. They got pain in their lower left calf, and they went on this long flight, and it's hot. Well, Miss Oren, they might have a DVT. Oh, they probably got one. Is a lot more here than, hey, we got to run down the protocol. We got to put them little things on them that all the patients hate. That's hot. The little blow up booties. This one probably got one. This one, they probably ain't gonna get one. They're gonna complain about that thing all the way. This is aimed at the NCLEX. These are trigger words. If they gonna throw some safety in there, if we're talking about like psych, suicidal ideations, if they a risk to themselves or others, us, that's gonna be the answer. Airway, of course, anaphylaxis. That's gonna kill you. Wheezing, epiglottitis. That is a true emergency. If you get to messing with that epiglottis, what's right below your epiglottis? Your vocal cords. What's below your vocal cords? Run your airway on down. Trachea. How do we intubate people? Through their vocal cords. What you finna be doing? You're gonna be doing a surgery. Guys, that's not fun. It bleeds a lot. I don't wanna be putting a scalpel in nobody's throat if I don't have to. Paradoxical respirations, intercostal retractions, where's that? In between your ribs. Grunting in infants is a deadly sign. Hypoxia, circulation, I told you, is not just circulation, it's cardiac, myocardial infarction, peritonitis, limb ischemia. Something that they prioritize is also lab values. What am I talking about? Which one's going to kill your patient first? Potassium, sodium? Potassium, why? It's going to cause complete cardiac standstill if it's high enough. A UA or hellaciously high calcium. Which one you going to prioritize? Hellaciously high calcium. What's neutropenia? It is. Let me relate it to cancer patients. It's reverse patient isolation. I'm protecting them from me. They have no white blood cells, and now they have a fever. It'll kill them. They don't have any warriors, right, to fight off an infection. It is an emergency. Yes, ma'am.
Did you know that Sonoma doesn't have neutropenic precautions anymore? Yeah.
Oh, yeah, they said that in the ICU.
They said that based on evidence-based practice, I guess, they weighed it and, yeah, I guess they don't have it anymore or something. So like, they're not allowed to put it on the doors unless the patient requests it, then they can, but they can't just implement it.
Okay, before I even pass judgment, I'm gonna look it up. But I know that's a lie. No, I can't say that because I ain't looked it up. Alright, I'm gonna look it up, and next time I'll tell you it's a lie. Guys, my best friend died from cancer. She had like 2 white blood cells. We were so freaking careful around her that I mean, we were all dressed in PPE around her. All of her friends are nurses. She was a freaking PA. We ain't stupid. I mean, oh my dear Jesus,
Yeah,
Lord.
I guess like the doctor said, well, if you're scrubbing in and out of rooms, there should be no reason to put on full PPE because you should be doing your hand hygiene.
That patient got C. diff. You gotta wash my hands.
Right?
But it's not even just what the other patient has, it's your normal flora that could potentially,
Oh, I brought you some fresh flowers.
you know, violate that first.
And some fruit and vegetables. I love you. Achoo. We brought the whole family to see you. I ain't washing my damn hands. Guys, if you are taking this test and my test, and they say that the patient's stable, get rid of it. Don't even look at that answer. If you got somebody that's got an airway breathing or circulation problem and you're gonna educate somebody, get rid of the education, the discharge. Don't even look at that. No. This is all things we have gone over. I just put this so that y'all can look at it. Safety is at every part of this. We already talked about it. It's even up here, and it may throw this down here. I just put this in here. So I don't have a problem with A, B, C, or D. But it kind of is a problem with C. Their blood pressure is 280 over 150. That is a problem with C. They need some meds, right? They're not bleeding. Lab values that are life-threatening. We just talked about that. Can medical problems be life-threatening? They got the diabetes and they ran out of their meds and they don't have the money to take care of it. And now they're in DKA and their blood sugar is 1200 and you're just gonna give them 11 bags of fluid. And you're gonna go down the potassium protocol. "58-year-old patient, stat order labetalol, 78 requesting an extra blanket, 32-year-old stat order beta-2 agonist for COPD." That's a patient. 3. What is a beta-2 agonist? I'm gonna beat you. Huh? How many hearts do you have?
One.
How many many lungs?
2.
What's a beta 2 agonist? It is. What do y'all give all the time for difficulty breathing? Albuterol is a beta 2 agonist. We just go over pharmacology. Telemetry, EKG, hospital admission, medication reconciliation. Be careful, EKG. Why not the telemetry monitoring? How long, what's the gold standard from the time you hit the door with chest pain? 10 minutes. This is important. I don't know you. Can you tell you're having a STEMI on that? It's real hard. You can suspect, but when you suspect, you gotta get what? An EKG. UA potassium, PT, PTT, serum, HCD. Be careful.
Potassium.
Potassium. What would be next?
PTT.
Yeah, probably that and then that. Y'all take a quick break, even if you stand up.